Good afternoon, and thank you for joining us today for the City of Lubbock News Conference. Today, for our panelists, we have District 4 Council Member Steve Massengale, City Manager Jarrett Atkinson, Eddie McBride with the Lubbock Chamber of Commerce, and Chris Berry with Riversmiths. So let's start with Councilman Massengale.
Thank you, Lacey. Good afternoon, everybody. The reason we're here today is we want to clarify the governor's order as it applies to the hospitalization percentage and what impact that would have on our economy. So I'm going to walk through some high points on this. I'm going to hand it to Mr. Berry, and then we'll open it up for some questions. So there's two executive orders that we're working under right now. It's the governor's order 31, which was effective September 17th, and then Governor's Order 32, which was effective October 7th. We're going to have copies, or if we haven't already distributed copies to you for reference. I think the way we want to talk about this is the effects are more of a pullback, not a shutdown. The executive orders don't focus on a city or a county, but rather trauma service areas. Okay, and right now on the visual, this slide over here, you can see the geographic area of our trauma service area. It contains about 500,013 people, and depending on the day, as we're learning today, it's about 1,500 beds, but we can see that our available beds have dropped from yesterday. Our hospitalization, the percentage of COVID patients hospitalized today is 16.64%, okay? So that's the formula, is the percentage of COVID patients or the COVID patients as a percentage of hospital capacity. So if that percentage stays above 15% for 7 consecutive days, and today we're on day 2, then the businesses that are at 75% capacity, restaurants, amusement parks, libraries, etc., retail, are reduced to 50% capacity. And those businesses that were open as a result of the Governor's Order 32 at 50%, which are bars, would close. So the other impact it has on our economy is if we hit those 7 consecutive days above 15%, our hospitals will cease elective procedures, and there's some more detail on that that's inside the order. So once we trigger into that period and we pull back, how do we get out of it? We have to have 7 consecutive days below 15% when we go back and look at that percentage of COVID patients as it relates to available beds. Now, anybody can see this data any day at dshs.texas.gov, and you have to filter through the COVID-19 page, and then you're going to hit the hospitalization data, which is the page that Mr. Atkinson has up here to my left. What's important to note that is if we hit this trigger, this is not a local order. This does not come from the mayor. We are still all operating under the governor's order, okay? So now we've invited Chris Berry to make some comments. Chris is a member of our recovery task force. He is president of the local restaurant association, and he's a small business owner that's been impacted by all of this. And so, Chris, thank you for being here, and I invite you to make some comments.
Thank you, Representative Massengale. Thank you, Representative Massengale. Thanks for having me today. We just wanted to address the importance of everyone doing their part, wearing masks, social distancing, doing everything in their part. Restaurants, as every business around has dealt with this since March and April. Restaurants in particular struggled from the get-go with dining room closures and heavy restrictions from the get-go. Restaurants every day are very familiar with sanitization, proper protocol. So this just takes it to the next level, which we are dealing with. However, if we don't do all our part, and this potential step back, if we see the 7 consecutive days of the hospitalization rate above 15%, would be drastic to all restaurants. Most of us are barely keeping our head above water, struggling mainly, I think, with consumer confidence. Consumers need to feel confident in going out to restaurants. We're doing our part, everything that needs to be done. We need everyone to feel comfortable in going out to eat, but everyone needs to do their part. Socially distance, wear your mask, and we'll get back to where we need to be.
Thank you, Mr. Berry. I think you make a great point. We know what simple strategies are in place for us to manage our business through this pandemic and do everything we can to keep our economy open. Social distance, wear your mask. To my left today is the president of the Lubbock Chamber of Commerce, my friend Eddie McBride. I'm glad he's here as well. At this point in time, we'll kick it open for some Q&A. Any of us up here are available for that. Mr. Dotre.
Good afternoon. Have there been any discussions on the task force about making it voluntary for businesses to roll back the capacity already?
No, we have not had that discussion at this point. We're still, the task force has mainly been focused on keeping up with the governor's orders at this point, adjusting guidelines. The most recent meeting on our Get Lubbock Open committee was related to, wasn't related to Halloween. Yeah, 75%. Yeah.
Okay, I know you all are the business task force, but can anyone up there talk a bit about what the governor did last Friday when he announced more medical supplies, more personal protective equipment? Has that helped hospitals at all?
I know the hospitals in our area are taking advantage of that. I don't know to what detail that is. I don't know if you can help on that, Jarrett.
Thank you, sir. I'll speak briefly to that. What you saw from the state of Texas late last week, certainly the PPE, the personal protective equipment, other medical supplies, what that was largely focused on, though, is staffing. So as you might recall from last Thursday's press conference, one of the big challenges at all of our large facilities right now, our medical facilities, is staffing. So Mr. Massengale mentioned that your total staffed hospital beds had changed from yesterday to today. That does have a lot to do with our percentage jumping from just a little over 15 to 16.6. Just having a hospital bed and having the medical equipment and so forth is not all of it. The people that are there to take care of the patients are the most important part of that, and that's what the state's helping to provide. That was provided to us. We're Region B, you can see on the map. I know that was also provided to Region A, and I believe there was a third region where the state is providing some staffing assistance.
Okay, thank you. We talk a lot about COVID fatigue. Do you think there's been some COVID fatigue from the standpoint of businesses? Maybe they're not checking temperatures daily anymore, not cleaning as well, things like that?
I'll take that one. Matt, I think there definitely has been, we're all tired of wearing masks, and we'd all love to get back to whatever normal life's going to be at some point in time in the future. But I hope this serves as a reminder that we need to continue to monitor temperatures. We need to continue to clean our hands, keep our distance, and wear our mask. And I know that sound gets old, but that's what makes the difference.
Okay, thank you.
Thanks, Matt.
Hello, good afternoon. Blair Sable with Fox 34 News.
Hi, Blair.
So one of my first questions, Mr. Massengale, you mentioned how do we get out of this rut? How do we get back to the 75% capacity limitations and that sort of thing? Has the governor at all spoke about what if the threshold continues to stay the same? We do not get under that 15% threshold for a long amount of time. Is there more shutdowns that we can expect or more rollbacks? Anything that we know about that?
No, all we detailed, and all I detailed today is what we know about the governor's orders. We haven't gotten any other direction from the governor. Keep in mind, we've got to have 7 consecutive days. We're not pulling back. We don't have any reason to pull back now, but we are 2 days into the 7 days.
So, and I wanted to clarify on that. So yesterday we crested that threshold, and today we are expecting to be over 15.
Today, we're at 16.64.
Okay, thank you. And earlier today, I spoke with Dr. Craig Ryan at Covenant Health, who I'm sure you're all very familiar with. He mentioned that the governor may be working closely with Covenant Health and the local area hospitals to address what happens now. And we know throughout this whole situation, the separation between state and local entities has been confusing and a little bit contentious. So do you know if the governor is, planning to give any leeway to Lubbock County or the city of Lubbock, anything like that?
No, I think the most important part about that is what Mr. Atkinson detailed earlier, is that there is help on the way and our hospitals are taking advantage of that. There's not, I don't know of any other direction coming from the governor's office.
Okay, thank you.
Mhm.
Good afternoon. I'm Sarah Self-Walbrick with Texas Tech Public Media. All of the projections I've looked at, and based on our new case count, it seems like there's a good chance we are going to hit the 7-day mark. So as businesses, what are y'all doing to prepare for that rollback? And what is the city doing to get ready for that if it happens?
I hope we don't have 7 consecutive days first. I can speak, I'm a retailer, local retailer. I can tell you that we're watching it closely. My business is closely tied to the Texas Tech football right now, and so we're very cautious about how we move forward. Mr. Berry might talk about, as a restaurant owner, it impacts him differently than it impacts me.
Yes, sir. Thank you. So, earlier it was questioned about, COVID fatigue and, kind of getting in the rut. I think a constant daily reminder is the significant percentage of labor that we spend on a daily basis to make sure the protocol is facilitated, the exorbitant amount of PPE that we spend on a daily basis, weekly basis, monthly basis to maintain everything we need to do. So, most restaurants, I think, feel strongly that we're doing everything we can in-house. We can't control what everyone else does. We can strongly urge our customers to follow the protocol and do what they need to do. But we're going to keep continuing doing our best to follow the protocol, to keep a safe environment for people to come out and eat, whether it's dine in or carry out, and we're going to do what we need to do.
Thanks, Chris. Mr. McBride, do you have anything to add to that?
Thank you, Councilman. And Sarah, yeah, I think business owners, there is COVID fatigue, but I think our residents have quite a bit of COVID fatigue as well. So I agree with what Mr. Berry got through saying and what the councilman said about his business. The fact that there are folks out there that obviously are just sick and daggum tired of this, as we all are. But the fact of the matter is this hospitalization rate is a warning that we've got to remember that the best way to protect ourselves is what Councilman Massengale's already said, is wearing a mask, washing your hands, following your safe distance protocols. And I think all in all, businesses are going to want to keep their businesses open to the max extent that the governor's going to allow them. So I think businesses are still, relatively speaking, and we hear reports all the time from the city manager about how well businesses are doing in Lubbock. And I think that's an attribute of them wanting to stay open and following those protocols. So I think all in all, it's just one that us as individuals have to take advantage of to make sure we mind our P's and Q's as well. Really appreciate the recent opportunity that the city manager and the city of Lubbock has given us to do another mask giveaway, and I think this is a good time. We'll be starting it Thursday afternoon. We have almost 200,000 masks that we'll be handing out to the public. So that's the little bit that we can do to make that available for folks. But the last time we gave away 150,000 in around 8 hours, so I'm sure that they'll go fast this time as well. But the intent is to help people realize they're supposed to be wearing a mask, supposed to be washing their hands, supposed to be practicing their safe distance protocols. We can get through this, but 5 days away from now. Let's hope that this lag and this case-demic that we're experiencing as well doesn't hamper our recovery from this 15% rule.
Yes, we're definitely all hoping for the best here. We hear every news conference from Catherine Wells that it's also the smaller gatherings that are contributing to this. It's not just our restaurants and businesses or anything like that. What can we do to limit or at least control those gatherings?
I'll start with that, Sarah. We all have personal responsibility in this pandemic. And for someone to go out and think that it doesn't apply to them, or that maybe they don't believe, or maybe what they've learned on their opinion of the pandemic on social media, this is serious. And you know, we live in a special place that our economy, I learned this a long time, doesn't always feel the highs of the highs or the lows of the lows of what everybody else might be feeling in the nation. The last 3 months of our sales tax collections have been higher than the same 3 months the year before. That's significant. Not every city in Texas can report that, nor cities across the nation can report that. We've done a good job. We've fought for our economy and we've kept it open. We've got to stay the course on this. It is a personal responsibility to take care of yourself and take care of others around you. We've got to do that. We don't need to get to this point of 7 days of consecutive hospitalization rate over 15%. Sorry,
Okay, thank y'all.
Hi there, Melanie from KCBD. We've talked a little bit about hospitals, and my question is, have any Lubbock patients living here, from here, COVID or otherwise, have they been turned away for critical care in hospitals due to a capacity issue?
I can make a comment to the extent that I know. I know that last week, I believe the hospitals were on diversion for a while, but I don't know their status today. Do you, Mr. Atkinson?
I don't know today's status. I don't think that anybody has been prohibited or denied care. When these hospitals go on divert, though, what that means is a patient that would have been at hospital A has got to get to B or to C or to D down the line. Those diversions last week did not last long, but that's a warning sign. I mean, it truly is. The intake side is filling up as the hospitals are doing what they need to do to provide that care and move people to the appropriate parts of the hospital.
It's probably best to confirm that with the hospitals.
Okay, thank you.
Hi there, Alyssa Tejas with KLVK News. My question is the city considering taking any additional action on top of the governor's order? The city of El Paso, of course, stopping businesses from being open past 9 a.m., so they have to consider takeout. Indoor sporting events are canceled. Is that anything that the city of Lubbock is considering?
We have not considered or discussed anything similar to what El Paso has done. If we got to the point that we thought that was necessary, we'll go back to our recovery task force and get their input before we make any decisions.
And then past that, we're only 5 days away from the 7-day mark. Are those restrictions immediate, the very next day, or is it as soon as we find out that we reach this number, is it automatically?
That's a good question that I don't know the answer to. Is it immediate, Mr. Atkinson, to what we know? I know we have Mr. Grace in the audience, too.
So there's only one region that has triggered this, and they triggered it yesterday. So we are watching them to learn. There has been one region that was prevented from the most recent reopening that was just allowed to go ahead and start. That region that had initially been kept closed and has now been reopened, that was an approval granted by the governor's office, by the state of Texas. So if I work backwards, I presume that on the side that this group works with, that's going to be a notice from the state, I believe, for the hospitals that will come direct through the Department of State Health Services.
Excellent.
I don't want to be the one to find out how it works.
Okay, excellent.
Great
Okay.
point.
And then are you all in conversation with the governor about us already reaching this figure for above 15% capacity?
I haven't had any conversations with the governor, but I'm sure he's watching closely, and should we get close to that point, my guess is that we'll start having regular conversations with his office.
Excellent, thank you so much.
Okay, we have a media question via Zoom from Christy Martinez from Latino Lubbock.
Thank you, Lacey. One of the things that you just said, Steve, you focused on livelihoods, but again, I have to remind you that without lives, and we've had quite a number of deaths recently.
Hey, Christy, hang on. We can't hear you. I can just barely hear you. Hang on just a minute. We got a volume issue in here. Oh, can I control this here? Main room volume?
Can you hear me okay?
That's a little better. All I see is mute on this. Main room volume?
Yes, sir.
Or hit more?
Go to that. Try that.
Okay, Christy, try
Yeah.
that.
Test 1, 2, 3. Can you hear me?
Yeah, you're better. Okay, I apologize. Go ahead.
I'm glad to see Chris Berry and Eddie McBride. I know that they're really doing a lot for businesses, but again, I know last time, Steve, you gave us an update on how great the city was doing economically, but I want to remind you about the deaths. And that death toll continues to rise as well. And on that note, Chris, you mentioned about all of the protocol that you guys are doing, and you see a lot of restaurants doing, but you're still seeing quite a few that are not following protocol. And I know we keep hearing about the bars. It's not just the bars. We've had a number of folks that have called us and talked to us about restaurants that are not following the protocol. So as the restaurant president or restaurant association president, Chris, what can you tell them so that we can prevent another shutdown?
Well, just like wearing a mask is a personal decision, enforcing the protocol is the personal decision, and whether they are compliant is a personal decision of that restaurateur. So I would strongly encourage, and I have strongly encouraged all of our colleagues to do their part, and everything we need to do. As the drum has been beaten, none of this is fun, none of this is enjoyable, but it is necessary for us to, we see the writings on the wall already. We don't need to continue down this path. We need to do what we can to do better. So we strongly encourage all of the restaurants and all of our colleagues to do everything in their part to enforce on their employees and their staffing to wear the mask, to follow the frequent sanitization of the frequently touched contact surfaces, everything they need to be doing.
This next question is for the city manager, because we're already seeing people starting to, they're getting scared. They're getting a lot of mixed information. Even through this conversation, I'm hearing wear a mask, it's your choice to wear a mask. And I get that. But the public is confused, and because they're getting so many different messages, and already they're starting to panic and starting to hoard. How are you going to address this so we don't see a repeat of what we experienced several months ago when this all started?
Okay, Christy, thanks for the question. I'm going to take it that the big part of that, the mixed message, I'm not sure where that's coming from. The purpose of today's discussion is to try to get the correct message out, really on what this 15%, 7-day, and so forth meant. As it relates to, and we have received reports that one local retailer, once again, is possibly out of paper goods. We all went through that some number of months ago. I've heard nothing from any of the medical professionals that tells me back several months ago or today or tomorrow that there is any reason to be hoarding anything. The supply lines are running just fine. COVID is most largely a respiratory disease. So please, we're in no issues. The supply chains are fully functional. Our stores are working well. We have no reports that there should be any reason for things to run out or for us to expect we cannot buy what we want or need to buy today, tomorrow, or any time in the future.
Thank you, sir.
Thanks, Christy. Anyone else? All right. Thank y'all. Is that good? Thank y'all very much
Thanks
for
for coming
coming,
out.
especially on short notice. We appreciate it.